Good afternoon, everyone. I hope you enjoyed your wonderful lunchtime panel. My name is Brittany McNamara. I'm the Development Director for the Children's Coalition for Northeast Louisiana. Before we get started, I want to go over a few quick housekeeping items. To keep things running smoothly, please stay on mute during the presentation. If Dr. Thornton asks questions, you can unmute and answer, but please stay muted during the presentation. We do encourage you to keep your video on if possible. It's always great to see everybody's smiling faces. You can also use the chat box to engage with other attendees and our speaker. And if you're having tech problems, just feel free to chat me. If you have any questions, just type them in the chat box. And at the end, we'll have a Q&A session. So anything you may want to ask then, you can just type in the box. So let's get into our last session of the day. Dr. Matthew Thornton is the CEO of the Center for Children and Families, a nonprofit organization committed to supporting children and families through trauma-informed, community-based mental health services. Over the past 19 years, and as CEO since 2018, Matthew has led initiatives to expand the organization's reach across Louisiana and Mississippi. He is a licensed professional counselor, a licensed marriage and family therapist, and an approved supervisor. Matthew serves on the advisory committee for the Center for Evidence to Practice at LSU Health Sciences Center, New Orleans, and chairs the Behavioral Health Committee for the 4th Judicial Services Child and Youth Services Planning Board. He also serves as an affiliate faculty member for the Family Institute at Northwestern University. Matthew lives in West Monroe, Louisiana, with his wife and their 3 children. So without further ado, Dr. Matthew Thornton.
Thank you, Brittany. Brittany has let me know that I have changed up the game a little bit with just the formatting for this. This is actually a Zoom meeting type of format. I like a little bit more interaction than a webinar can give me. So if you're in this presentation, I definitely would want you to be active in the chat. I've got it up for me to be able to see. And so you can put questions in there as we go along, and I'll try to answer those as I can. Or there'll be time at the end where I'll make sure to have plenty of time for us to talk through some questions. You can also put your camera on if you want to. I know it's the afternoon session right after lunch. It is the I guess the death zone when it comes to conferences right after that. So I'm going to try to keep as much energy as possible as we go through the information this afternoon as well. But I just want to thank each one of you for joining in. I've enjoyed the conference so far. I was telling folks it's been quick hitting. The presentations have been great. They've been very informative, and they seem to turn over so quickly with that format of about 45 minutes. So, but I want to give you guys a little bit more about sort of the perspective that I'm coming in with. And while I do that, if you would warm up your fingers by putting in the chat where you're coming from, what organization, and where you're located. That will give me an idea of some of the folks that we have in the room and where you're coming from and why this might be meaningful to you to be a part of this presentation. So we're going to talk about children's mental health in Louisiana, and particularly some of the challenges and even some solutions I think is important for us to be able to identify as well. But for me, I am the CEO of the Center for Children and Families. I've been with the agency for a long time now, 19 years. And some of the spaces that we work in, I want to share with you about a little bit about those just very quickly. We operate a CASA program, which many of you may be familiar with CASA programs that help advocate for kids that are in our foster care system. We have a children's advocacy center that serves the northeast corner of the state that provides forensic interviews and medical examinations for kids that have been abused, or neglected, or that have witnessed violent crimes. We just recently, over the last couple of years, opened a Hope Center in West Monroe, which provides psychological services and medication management for kids. That was a huge need in our area of the state, and we'll talk a little bit more about some of the shortages we're seeing around the state as well. Brokers of Hope is a very unique program. It's specifically working in Union Parish, which is one of the largest parishes by landmass in Louisiana. I mean, it has extreme poverty in certain pockets of that particular parish, and that program is working with families that are in extreme poverty, making sure that they have the concrete resources that they need. We're talking about adequate shelter, clothing, and food, and then connecting kids to the resources that they need, whether that's educational or healthcare, anything like that. And we serve a lot of families with very young kids, and so they're needing diapers and wipes and formula and that sort of thing. So it's a really heart-wrenching sort of work that they do, but they're doing amazing things in the communities up there. We also serve the Family Support and Youth Transition Program in partnership with the Office of Juvenile Justice. And we serve North Louisiana, Alexandria North, with that program. And it works with kids that are involved with the juvenile justice system, that have been incarcerated and that are coming back home to their families and community, or that are extreme risk of being incarcerated. And that program has extremely high success rates, over 90% every single year when we do our program evaluation of those kids do not reoffend that work through that program. So I'm very proud of the work that's happening there. But the largest part of our company is the therapeutic services. And that's community-based services in large part that we're doing out in the home and in the community, mental health services. And we've got regional offices in Monroe, Louisiana, which was where I'm located, over in Shreveport, Louisiana, down in Crowley, Louisiana, serving some of our areas down there, and over in Clinton, Mississippi. And so that's the perspective, the kind of the lens that I'm coming from. Thank you guys for putting in there where you're coming from. I'm seeing some familiar names pop up on the screen. That's always fun to see folks that you know that are joining you as well. So, and I also want you to know where other folks are coming from, because as you talk through things as we go through this presentation, I'm going to ask you to put some your thoughts and ideas around mental health in there as well. And so it may be very helpful for people to know where you're coming from, where you're located, and why you're seeing that particular issue in your particular area. But before we do that, before we zoom around the state, I want you to take a little bit of a mental exercise with me, if you can, and think back to the year 2003. Some of you may not have been born yet. I realize now that I've gotten to the age where some of my stories, people weren't even alive at that point. But if you can, think about 2003. And in September of 2003, my wife and I, who had been married for just a little less than 2 years, were expecting our first child. And in September, we were in labor and delivery. The doctor was there, the nurses are there, the breathing exercises had started. I'm holding my wife's hand. She looks up at me and she says, "Are we ready for this?" And the only thing that I could possibly utter in that moment was, "It's too late now." And here we go. Before we knew it, we had the little bundle of joy that we're taking home. Our little daughter was born, and we're taking her home. And on the way home, y'all, I'm driving as slow as possible because it took me forever to get her in the car seat. I'm so worried that something's going to happen. Her mom, my wife's mom, is in front of us in the car. My mom's behind us in the car, and we have this cone of protection going down the street to get us back home. And man, they stay for a couple weeks and help us out. Her mom did, and we're young babies ourselves. In all honesty, at the time I was 23. And so we're trying to figure this out. And a couple of weeks in, after her mom had gone home, and we're there with our sweet little angel, she starts to cry. And it's a different sort of cry than what we've experienced before. And she doesn't stop crying. We make sure she's changed, she's fed, we know she's not cold, but her little stomach is in knots. And her face is blood red, and it looks like she's about to burst a blood vessel. And my wife is looking at me. She's like, "Do something." And I'm like, "I don't know what to do." And so we're picking up the phone. We're calling the nurses that we know that are friends, and we talk to our pediatrician. And you can go ahead and put in the chat if you know what we're dealing with at this point. And what we found out was that she had colic, where that was the diagnosis. But interestingly enough, there's not much known about the why this happens. So the causes of colic are kind of unknown. There's some possible causes, such as the digestive system developing, which is what we thought. So we were starting new gas drops. So we changed formula to the most expensive thing that we could possibly afford on our little income. It could be hormones going on, sensitivity to light. There's so much that's happening with these little ones. And it can be their developmental, their nervous system developing, all that sort of things. But there we are trying to figure out how we can help our daughter. And the only thing that seems to help is I hold her as closely as I can to my stomach, pressing her stomach against mine. And I rock her back and forth. I sing whatever lullaby I can possibly think of as softly as I can. And I start to breathe a little bit, and my wife lays down beside me. and she gets some rest, because when you have an infant, you don't rest. And when you're nervous about having an infant, you don't rest even when they rest, even though you should. And the knots in her stomach start to unwind and loosen a little bit, and she starts to not cry. And so what we found out retrospectively about colic is that it is most common in firstborn kids. And it usually starts about 2 weeks after they're born, which is usually when all the family's away. And it usually subsides about 3 months. So when you get to that point, when you start to realize, okay, I think we can keep her alive, maybe. And as we settle down, then her stomach could unknot and things could settle down for her. And we start to realize that I did retrospectively, looking at sort of this ecological approach to understanding what's happening with our kids, and especially when they're young. And what I learned is that there's certain links to this with colic, specifically around maternal mental health, particularly postnatal depression, caregiver anxiety, which you could see all over me as I was even telling that story. And then it is also linked with later behavioral and developmental issues and problems later on. So there's some contextual factors that are there that are a part of this as well. And so that really is some of the lens that I come and I bring to the table, is thinking through things in terms of contextually. But I also want to talk some about just generally children's mental health and some of the things that our kids, younger kids, are facing. And if you look at this list, it's a pretty adult list. So just about everything that you think about in terms of mental health with adults or adolescents, our little ones also have those same sort of struggles, but it oftentimes looks different for them in terms of how it is expressed. They can't say, I'm sad, I'm depressed. They can't say, I'm stressed out. A lot of times it's going to come out in different ways. And so we have to look at what are those signs for mental health? What are those changes in terms of sleeping habits, their eating, school performance, withdrawal, those sorts of things. We have to be aware and kind of be detectives for what's going on with our kids and how those things are being expressed. The other thing that we look at is those ACEs, so adverse childhood experiences, and many of you may be very familiar with that. And some of the things that we are used to seeing on those lists have to do with abuse or neglect, family violence, or crisis situations. But some of the things that we may not think about as much is early hospitalizations or illnesses or sicknesses. A difficult birth can be a traumatic experience for a kid that impacts them early on. Difficult pregnancies, oftentimes we don't think about that sort of prenatal time frame in terms of their development as often with mental health, but that has an impact on those kids and system effects. And what I mean by this is there's a lot of times where there are systems issues or things that are going on around a child that they really have no control over, but that impact them greatly. We were talking about the CASA program earlier, and kids being removed from their home and placed in foster care. That's a system impact on that kid. Even though they've not done anything wrong, they've had to be placed in a different living situation. There could be a family member that's placed in prison, or other kinds of things that are happening around that. It could be issues at a school, or those kinds of things that are happening where they have to be displaced or moved or that sort of thing. And so all these things can really impact our kids in a negative way. And so in the same way, if you think about those trauma experiences and how that's expressed, if you look at this list, it's very similar to those mental health disorders as well. So we got to do a good job of doing a differential, if you're in mental health, of really looking at what are the experiences that are influencing the behavior that's going on with a kid. But these are some of the things that we look for if you're working with a kid and you're starting to see this, start to assess for, are there some adverse situations that are going on that may need to be addressed. So I'm zooming through these slides pretty quickly, just to let you know, but they are available as a resource as well. So you should be able to access them. If you need them later on, you can contact me and I can get them to you. So I'm going to get into some slides that have a little bit more data on them. And so I'm still going to be moving pretty quickly just for the sake of time. But I want to make sure that we cover as much as we can. So what I want you to know about children's mental health is, one thing here is that there are predispositions. So there's genetic factors that play into a child's mental health and the outcomes that they may have. But those are not destiny. That's important for us to understand. Environmental influences can either inhibit or activate those predispositions with children. And so that gives us a lot of hope if you look at it one way, and it can be a little bit stressful if you look at it the other way. because that sustained stress-inducing experiences can create an unstable foundation for kids for a lifetime. And you guys, that we've already talked in some of the sessions about how much the brain develops in that 0 to 5. It's like, it's a lot of time that sets the foundation. And so we have to be very mindful of the types of environments that our kids are in, because that will dictate the foundation that they're in. But we're not sort of static in that. That is the hopeful thing. If you're working with kids and you're trying to create that safe, nurturing environment, you can create that solid foundation for them. You can protect and even improve some of their mental health outcomes by creating that, especially for kids that have come through some adverse experiences. It's huge for them to get in those spaces where they feel nurtured and cared for in a big way. So if there's questions along the way, like I said, please put those in, but I'm going to ask for a little bit of feedback in just a second. We're going to zoom through the landscape of challenges and things that are going on in Louisiana. I'm going to share some data with you that I have. We're also going to talk about strengths and then recommend some solutions. But first, I'd love for you, from your perspective and what you're seeing, type in the chat, what are some of the challenges that you see? Or as I go through some of the slides that I have here, what resonates with you, or what are you also seeing as well? So I'm gonna throw some stats at you to kind of give you a little bit of a sense of what's happening in Louisiana. The first thing I want to share with you is kids that are 6 to 17, about one in 6 of them has had a mental health disorder every year. And that's sort of national data, but it's looking at estimates in Louisiana. About 10% of the kids in Louisiana were diagnosed with depression or anxiety in 2020. And a big one here that I think is important for us to understand, and that last one there, this is data from 2021, there's estimated over 62% of kids that had depression or that were suffering from depression did not receive any care or treatment during that year. And that's going to be a recurring theme, I think, as we start to look through the data around that mental health professional shortage. Some of the other contextual things that we have to look at, we've got a pretty high incidence rate of child abuse and neglect in Louisiana. So reports in 2023 were over 50,000 reports of abuse or neglect, which sparked over 20,000 investigations into those. So usually there has to be a threshold in order to spark an investigation into that. We had over 6,000 kids that were in foster care in 2023. And we have a critical shortage of foster care families and foster parents in Louisiana. If you've been in that space at all, you realize that there is some serious struggles with trying to figure out safe homes and places for kids to go. We've got to do a better job as a state, really stepping up to that challenge there. And then we've just started tracking some of this number on as far as the human trafficking with kids. Over 1,600 kids in Louisiana in 2023 were identified as having been trafficked. And that's a pretty staggering number. And that's only what's been reported and identified. That's just scratching the surface, because we're just now beginning work on that front as well. A couple other things just to be aware of. Is about 30% of kids 3 to 17 in Louisiana have one or more emotional, developmental, or behavioral issue. If you look at as kind of zero in on one in particular, if you look at ADHD, about 17% of our kids have been diagnosed with ADHD or ADD. But only 7%, a little over 7%, receive behavioral treatment. There's a little bit more that receive medication. A little over 12% of those kids will receive medication for that. But there's still a number of kids that have untreated ADHD and ADD. And then some of the big numbers that I want to hone in on is right now there's estimated that we are only meeting about 24% of the mental health needs of our residents here in Louisiana. And if you drill down even further in terms of our 0 to 5 population, only about 21%, a little over 21% of mental health providers are serving kids in that age range. So if we're only meeting 24% of the total population, and we only have 21.5% of providers that are actually serving kids that are 0 to 5, then we have a massive shortage of providers that are focused in that area. All right. Yeah, I'm seeing some of the things that are coming through. Brittany, and you, if you can track some of those, if we have questions as they come along, but I'll try to do my best as well. Sonia's concerned about the lack of age-appropriate interactions involving children and adults, as well as multi-age groups. Yeah, there's significant issues in terms of the settings as well, with a lot of things. Accessibility of mental health for providers is huge. That's great. I think you're tracking with me in terms of where I believe some of our challenges are as well. And here's the map. Here's kind of the thing that you can't argue. The entire map is blue. In terms of mental health professional shortages in Louisiana, we've got 2 parishes that are not considered that, but the rest of Louisiana, either from a geographic standpoint or from a low-income population standpoint, does not have enough providers serving in those areas as far as mental health professionals. So that's a huge issue that needs to be addressed in Louisiana. And there's some of the drivers for that. So we want to think about, okay, well, what's driving that shortage? One of the things, and I think you oftentimes, if you talk to any mental health providers and anybody in any sort of nonprofit space at all, funding is an issue. A lot of the presentations today have talked about how to create good funding mechanisms to support the services and what we're trying to provide to our kids. And for those of you that don't sort of speak CPTEs, I'll spell that out. That 90837, that means a 60-minute psychotherapy session provided by a licensed mental health professional. So our Medicaid rates are half of some of the surrounding states. But it's not only specific to Medicaid either. We also have a disparity in terms of our commercial insurance, and this is one example of those, the Blue Cross Blue Shield reimbursement rate in Mississippi versus Louisiana. So we actually have a consultant that has said that we have a disincentive for licensed providers to provide mental health services in Louisiana. So our system is set up right now to disincentivize our services. So that's not great for us. And it is something that we have to address long term as a state. Here is a fun bit of data. And so I'm going to kind of share what this means. Don't be scared of the bar graph as it comes at you. So this is looking at, I had the ability to work with a team from LSU Health Science Center in their Center for Evidence to Practice. And we were working with them as a part of their advisory board when COVID hit. And so we had to start looking at, okay, what's going to be the impacts of services in Louisiana? And so this is actually a breakdown of telehealth or hybrid care in Louisiana versus in-person care. So the blue is in-person. And as you can see in 2019, all the way through starting initially in 2020, most of the services that we provided in Louisiana were provided in person. And this is a breakdown of providers, so not necessarily services, but the providers themselves and the types of services that they provided. When the pandemic started to hit, you started to see some use of hybrid, and then Q2 in 2020 is when the stay-at-home order happened. And so you can really see a sharp increase at that point of use of telehealth and hybrid care for families. Obviously, that makes sense contextually. But one of the interesting things that's happened since then is you look at the data as you continue to go through Q2 of 2022, there is a sustained use. Even though the pandemic started to subside a little bit, even though the stay-at-home order was lifted, all of those sorts of things, those barriers, there was a sustained use of telehealth services and hybrid care for families. So our system has adapted to utilization of telehealth and hybrid ways of delivering service. And there's a lot of interesting data that goes along with this in terms of who is actually accessing care through these different means, but it went across sectors. And so all demographics, even in some of our rural areas where there was some issues in terms of connectivity, we're still utilization of telehealth services, and particularly in our small urban areas. There was a high usage, and that makes sense to me as well, because there's probably fewer providers in the small urban areas, but they may have better connectivity as well. So we've seen that sustain over time. And this actually gets into a little bit of some of the strengths as well. So I'm going to transition a little bit. We're moving quick here. We only got a few minutes left before questions really start to pour in, hopefully. But we've got, what are the strengths? So as you sit from your seat, what are some of the strengths that you think we can leverage in Louisiana? So I've talked about one is our adapting to the needs of our clients in the circumstances of the pandemic to implement telehealth services. That's been something that's improved. One of the other things that I really love is we've started to see the more utilization of evidence-based programs. The Center for Evidence to Practice kind of has a map. You can go on their website and see who's been trained in what in terms of provision of different evidence-based programs. And this kind of is a visual representation of the growth of that. So we've got providers that are interested in providing evidence-based services. They're participating in training. They're doing that sort of thing. So we've got a great group of folks that are out there that are trained to deliver. Now, implementation is a whole nother ball of wax. So actual implementation and utilization of these services is lagging behind. Some of that has to do with the rates as well. So I'll shift on, keep moving here. These are some of the evidence-based programs that have been implemented in Louisiana. And a lot of them are geared towards kids that have experienced trauma. There's quite a few of them that are family-based, which I feel like is extremely important as well. I don't have time to really go into each one of these, but that QR code will take you to a website that will give you a little brief about each one of these different models. So if you want to learn more about the Nurse-Family Partnership, which has been around a long time, or Triple P, or the youth PTSD treatment, or preschool PTSD treatment, you can follow that QR code and it'll take you to a little bit more information about that. And you can dive in as far and as deep as you want to in terms of those different treatment approaches. But we have these available in many of our communities, not in all of them, but they are available. One other area in terms of an evidence-based approach, and this is not a treatment approach, but this is something that I've seen that's taken hold in Louisiana as well, is TBRI. And I hope some of you have heard of TBRI before, trust-based relational intervention. It's not a treatment modality per se. It is more geared towards training caregivers and parents in how to interact with kids that have come from hard places. It's developed through TCU. The Care and Purpose Institute is where most of the training, but we've got local partners here in Louisiana that can help provide training in that. Crossroads out in New Orleans is one of the big partners with TCU to provide training here in the state. They've done some great work around the state, particularly up in the Shreveport area as well. They've implemented in schools settings, and it's been great. There's a lot of momentum with DCFS around this as well. Formerly known Judge Matlock, who is now Secretary Matlock with DCFS, was a big advocate of bringing TBRI to Louisiana. And so he has really wanted to bring that into our child welfare system as well. It's a great approach if you're wanting to implement something in a early childhood setting to help with those that are teachers or caregivers in those early childhood settings as well. And it's got a lot of great momentum and good evidence behind it. We have trained just about everybody in our agency in this, whether they're a therapist or receptionist, everybody. We want folks to be able to interact with kids in a way that's going to build healthy, trusting relationships, because we've already talked about what kind of foundation that's going to build for them. And so partnerships and coalitions are something that I feel like we are starting to see improvement on as a state. This is something that I think is critical for us to be able to succeed. And we're starting to see that build. This conference is actually a testament to that as well. But we've started to see examples of that on a local level. The Harbor over in Shreveport, Volunteers of Youth Justice, the VYJ over there, really put a lot of effort into trying to bring agencies under one roof in order to help kids. And so we've got this list of agencies that are actually in the same building that are coordinating services together. The vision for that is phenomenal. We've enjoyed being a part of that. And it's what I would like to see more of. We've talked about the Youth Service Planning Board in Northeast Louisiana, the 4th JDC. We have a very active Youth Service Planning Board. Over the last couple of years, we've relaunched that in full earnestness, and we're making sure that we're doing what we can to assess what the needs are for our kids. We're focused on early learning, early reading skills, and then also mental health as our two main priorities for that. And that is bringing people to the table that need to be there. And that's from schools, our local government officials are there. We've got organizations in the nonprofit sector and faith-based organizations as well that are represented, and youth are a part of that as well. So it's a great thing. So if you're in an area that either has a youth service planning board or doesn't, get involved. Every judicial district should have one. But it's legislated, but there's no funding for it. So you kind of have to champion that for yourself. But we also are seeing in Louisiana Some great statewide initiatives. The Whole Health Louisiana initiative is one example of that, where there's a initiative at a state level that's building a coalition across the state. There's a lot of planning went into the Whole Health Louisiana plan that's out there, and you can link to this, and this will take you to a little bit more detail about that if you want to learn more. But it's the first statewide plan to really address the widespread issue of child adversity and trauma. It started with the Louisiana Department of Health, but the Blanco Public Policy Center is helping with that, and then agencies throughout are building a coalition. We're at the place of implementation of this particular plan, and when it comes to plans like this, I have seen them die on the vine when we don't have local champions. And so if you're interested in how you can be involved with making sure to move this forward at a local level, now is the time to get involved at that level. Because if we don't have feet on the ground in the communities that we're serving, then this will be a great initiative and a great report that someone will be able to find in the archives of LDH somewhere. Or it can be something that we leverage as a community or as communities to really push things forward. So it's something that I would recommend if you're not involved in, if you're looking for an avenue to be able to help push forward initiatives, that's one way to do that. The other thing that I think is a strength, and I could talk more about this, and I wish I could squeeze more of our universities on here, but we've got a great network and canvas of universities across Louisiana, particularly having mental health graduate programs. And if you're from a program that was not listed up here, I promise I didn't mean to leave you out. It just couldn't squeeze everybody on there. So we've got good coverage, but when you start to dig into these particular programs, a lot of them are underfunded. They're looking for faculty. Those faculty are underpaid. They're struggling to meet the needs of those students. And then there's a lot of issues with trying to find good placements for mental health providers in terms of internships. So while we've got the canvas, which is a strength, we really do need an investment in partnership with our universities around those particular mental health graduate programs. And we have a lot of them, then many of them are doing great work. I know because I recruit from them to come work at our agency, and I'm thrilled when we get good graduates that are coming from our programs around the state, and they get out in the community and are able to do fantastic work with kids. Okay, so I'm going to give you kind of a summary of what the challenges and strengths are that we have. So one is huge, the unmet needs. We've got a large demand for mental health services. Awareness is up, but we don't have the providers, and that comes into the next area there. And we have pretty low reimbursement rates for our providers, which really creates a challenge. We're adaptive, though, to telehealth. We have some adaptability in our system. We have an increase in evidence-based services. We have local and statewide partnerships, and we do have graduate programs that kind of canvas our state that give us the mechanism to try to address some of the issues that we've had. So I want to get into some of the recommendations then that I have as I kind of see the landscape that we have. And one is the workforce development. That comes up over and over again. I feel it every day with trying to meet the needs in the communities where we serve, and I know others do as well. We've started to have schools reach out to us, different settings reach out to us and say, hey, we have real mental health needs. Can you help integrate a provider into our system? And I have to tell them, I don't have anybody to spare. And so we really have to address that. So investing in those graduate programs, and particularly around the practical experiences of graduates, those internship placements in the community, I think are critical. There are some pockets of some things that are happening with that around the state. I know McNeese right now has a grant that helps to pay interns and pay their site a little bit to make sure that they have income coming in, because a lot of these students, as I was, are trying to work and do internship and go to school, and so there's a lot that's on the table for them, and it can really derail them. And so investing in those practical experiences and those internships, I think, is critical. And then also on the other side of that, we need to provide technical assistance to providers and organizations that want to be internship placement sites. A lot of times they don't know how to create a great experience for interns. And so what can end up happening is someone that's going through their graduate program starts at an internship site and gets burned out, or they're unprepared for what's about to happen or who they're trying to serve, and they exit the field. And these two things working together is going to create those graduates that are going to stick with their career. Because what I see at our agency, if someone comes to work for us, if they're going to leave early, it's going to be within the first 6 months. They're going to get into the community. They're going to see the needs and the complexity and the difficulties that our families are seeing, and they're going to say, I'm not prepared. I can't do this. And so making sure that we're investing in those graduate programs, I think, is critical. The other thing is funding. It always comes up, but I want to think specifically about this. I think we've had success as a state when we look at individual rates for evidence-based services and increase that access to quality care, not just a random increase in all rates. We want to look targetedly at the evidence-based services that we want to incentivize in our state. And the other thing, a lot of what I hear from other states is you cannot rely solely on Medicaid funding. You have to look at other funding mechanisms in order to help support mental health services in your local communities. You can do that at a local level or a state level as well, but we have to be able to look outside of just Medicaid in order to really reach the communities. It's just hard to sustain, for providers to sustain. To give you a little bit of a stat on that, in the last 2 years, we've lost 76 providers in Louisiana. We have 76 less mental health providers, and those are organization providers in Louisiana than we did 2 years ago. So each year we're losing more providers because they can't sustain in the system that we have set up for them. New providers come on board sometimes, but that's a net loss of providers in the state. Partnerships, we talked about this, and I want to make sure that we're increasing that. We cannot be siloed anymore. We have to reach across the different organizations into different spaces. That's why I love that this conference has a space for mental health for us to talk about that. So participating in those local initiatives, getting involved at statewide initiatives, those are great. And then building formal agreements on a local level with mental health providers into childcare, early education, school settings, I think is going to be critical for mental health for our kids. And then implementation. This comes down to brass tacks. We've got to make sure that we're implementing programs that make sense. So those evidence-based services, trauma-informed practices in settings that have the potential to have the greatest impact, i.e. TBRI in early education settings for kids. And then for me, always, when it comes back to that ecological framework for me, utilizing family-based approaches is critical in order to address those environmental influences that really set the foundation for our kids throughout their life. So, all right, I think I have sped through a lot of information really fast. And so I want to leave a little bit of space for some questions if you have it. If you're a brave soul and you want to unmute, that's one of the reasons I have this format is you can do that. You can ask a question or you can put something in the chat. Brittany, if y'all seen any questions that came through that I wasn't able to see, you can let me know. I don't know that I saw any questions come through.
I was keeping up with it, and I think the last comment you had mentioned was the last one that had come through. So, but if anybody has any questions, now would be a time to type them in the chat box, or like Dr. Thornton said, be brave and unmute.
And I'm an open book if you want to ask something around the system or also just about me personally, whatever. And just to complete the story, my sweet little girl is now 21, and she is a junior at Louisiana Tech University and doing very well. She did survive childhood at my house, and we now have 2 other kids as well at home. But yes, she did survive.
Well, you got some praise here from Dr. Candace Weber. Very informative session. Thank you, Dr. Thornton. Really enjoyed the information. So I think that was a great session as well.
Dr. Thornton, I have a question.
Absolutely, Jessica, go ahead.
Okay, I'm sorry I came in late, so I missed your intro. But I do represent a client that does a lot of parenting coaching, and specifically for parents that are dealing with children that have developmental delays or disabilities, mental health issues, things like ADHD diagnosis, behavior diagnosis. And so it's the Center for Children and Families. We've worked with them before. We've done some domestic violence work with them. But what are some things that she can do in the community, some places that she can partner with to be able to expand that? because there is a need for parents to have a space where they can speak to someone and get advice on how to approach, like talking to teachers and how to handle maybe considering putting their children in special needs or, to navigate a new diagnosis. So what are some places you think that you can partner with to where my client can offer services and they be able to utilize them?
Okay, Jesse, it was a little bit static coming through.
I'm sorry.
It's okay. It's all right. It happens with technical things, but I think what you're asking about is if you're working with a family that has a child with developmental issues, maybe even some neurodivergent issues with ADHD and those kinds of things. What are ways in which you can advocate, or what organizations can you partner with? And I would say, start with depending on where you're coming from. If there is, calling our agency, the Center for Children and Families, we can connect you with other resources up in the northeast part of the state. I know that the Children's Coalition has a lot of services as well that helps with families. And so I think starting there with just knowing what the resources are. If there is a child and youth service planning board in that area, contacting them or those organizations that are a part of that, because there's already a network in place. So looking at where the coalitions in your local area is the starting point for me, and who is actively involved in that. Because I hate to say that there's, I don't like there to be a wrong door when a family needs help. I want them to be able to call any agency and us to be able to help direct them in that way. So I would look for agencies that have evidence-based services that are available. So if you want to look at the Center for Evidence to Practice, that map is available, and you can look in you can drill down into your specific area and see what programs are there and where you think might be the ones best suited for them. But that's some of the things that I would start with that, is to try to make sure that you're finding those organizations that are active already in that space in your local area.
Okay, could you give me the site again with that map?
Yeah, so a quick search of the Center for Evidence to Practice at LSU Health Science Center will take you to that map. There's also in the slides that I have, which should be available to you in the resources section of this session. You should be able to click on that. There's a QR code that would take you to some of those different programs, and you can navigate from there as well.
And then one last question. So, what do you do at Stand for Hope? I see that this is.
Yeah, so I'll click back maybe all the way to the initial slide that I had that kind of covers all the different things that we do. Oh goodness, I should have done that a different way, but here we go. So for me, I'm the CEO of the Center for Children and Families, and these are the divisions that we have as an agency. So our CASA program, Children's Advocacy Center, and several other programs that we have. The mental health services is the largest thing that we have as well. And you can contact us at standforhope.org. You can go on the website there to find out more about any of these particular programs that we have.
Thank you so much. Great presentation.
Got just a couple more minutes if there's any other questions that come in. Well, I will just say thank you to everyone for hanging in there with me. I know I traveled really fast. I noticed in myself that I was talking much faster than I normally do, but it was a lot of information I wanted to get out to you, and some resources, hopefully, like for Jessica to be able to find and connect with. That is really the hope for me in this presentation, that you came away with at least one area where you want to find out a little bit more information, and that maybe you can get plugged in and help move some of the initiatives that we're trying to do in the mental health space forward for young kids as well, because you guys are the ones that have direct access and can be able to help move in that space for us. So thank you all for participating and being a part of this presentation with me.
Yeah, thank you so much, Dr. Thornton, and thank you all for joining us. That was a wonderful presentation. Thank you for sharing your expertise. I did try to share the link you were talking about in the chat. I hope it was the correct one.
It is.
But I do want to take a moment to remind you guys that there's going to be a quick survey about this session. So you'll see a pop-up in the top right screen and when you get back to the lobby. If you don't mind taking a few moments, just take that quick survey. We would greatly appreciate it. And if you don't mind, join us for final thoughts and directions on next steps in our closing session. So thank you again, and we really hope that you enjoyed today.
Hi, everybody.